Welcome back. India has now hit back at the WHO reports claiming that COVID could have killed as many as 47.4 lakh people in India in the year 2020 and 2021, either directly due to the infection or through its indirect impact. Even Bill Gates has lauded India's COVID fight. In an exclusive conversation with our editor-in-chief Rahul Shivshankar, now Bill Gates has hailed India's response to the crisis.
I want to quote a little bit out of your book. You've written, the lower your excess mortality, the better you're doing. In fact, some countries, excess mortality is actually negative. That's because they had relatively few deaths from COVID. And there were also fewer traffic accidents and other fatal incidents because people were staying home so much more towards the end of 2021. How do you assess the manner in which India has fared on this parameter?
You know, surprisingly, the rich countries have a higher death rate than almost all the other countries. It's kind of the U.S., Europe, and a few countries in South America, like Peru, have the highest. Now, part of that is the age structure. You know, this is a disease that really a lot of the deaths are people who are over 60, and also working indoors makes it more dangerous for you. Overall, you know, India did an amazing job not only making vaccines, but also getting them out to people. India has a better vaccine coverage than the United States has. You know, the thing it needs to put the energy into now is that boosting for the elderly, but both the manufacturing and the infrastructure for vaccines, India was one of the best. The idea of which lockdowns were appropriate when, we're still digging through that, trying to understand, when schools are shut down, of course, there's a real cost to that. And so, I hope we can understand better when that tactic should apply and when it shouldn't. The entire world is a bit unclear about that.
Well, in this context of excess deaths, there's also been a very robust debate worldwide about the authenticities of fatality figures. Now, obviously, every nation has been accused, and I'm not pointing out one particular nation as having suppressed figures. Do you believe that this is a fair assessment, that nations have deliberately gone out there and suppressed figures, and can this actually be done in a democracy?
Well, I think the experts will be, figuring out those death numbers, for some time to come. At the basic scale of them, you can take, funerals and a variety of things and come up to a pretty rough number. There's always going to be some uncertainty. Our foundation, tries to make sure that things like, okay, how many children die when they're young? How many children die of diarrhea? We try and help out with statistics just so we know which vaccines we need. But the death discussion is worth having. I think all the numbers I've seen, India's death rate is quite a bit lower than the rich countries, even though there's still some debate over what those numbers are.
Are you surprised by that, or do you think that this has been done deliberately? Because when there was an anomaly, it was called out almost instantly in the media, and that's why I came around to the fact that can it actually be suppressed? Can fatalities be suppressed in democracies that are quite open?
Well, India's always got vibrant debate. It's part of the beauty of the Indian democracy. So, people, I think, eventually will come to a consensus on those numbers. What's clear is, what can a government do? A government can get out oxygen centers, and I know Ministry of Health, worked very hard on that. Our foundation and some Indian philanthropists like Tata Trust and Piramal got involved in that. It can activate the manufacturers. We worked with Serum, and of course the government did. We worked with BioE, did great work, which the government supported. So for most of the things that are within the control of the government, India, stepped up on this one. And eventually we'll understand what the death levels were. But, vaccination, mask wearing, those are the things that the only tools the world had this time. Even the vaccines weren't perfect, although they prevented severe disease and death. They didn't, particularly once Omicron came along, they didn't prevent reinfection. And so in my book, I'm pushing hard for a lot of R&D, which India will be a helpful part of, for a new generation of vaccines that have longer duration and that completely block infection.